Yeah, I tend to be first alphabetically, and I will say thank you for having me here. It is just really terrific to have the chance to speak on this panel. Both Einar and Glenn are people who I've learned an enormous amount from. I think when I was starting out as a legal scholar, I will say what was incredibly daunting to me was Einar had done a bunch of writing in areas sort of in and adjacent to what I was writing in. And I have to admit, I thought there's no way I can be a legal scholar who can write as interesting and as smart and as deep and as penetrating work as Einar does. But I learned so much from engaging with him as a colleague and his work and the work of Glenn, who I've never had the chance to serve with in the same school, but have read his work and engaged with so many times, and seeing what this center has become is tremendous. So it's a real treat to be here, and it's a treat to be here with Dan, who I went to law school with and whose picture I walked by every day when I was HHS General Counsel, and with Rochelle, who was my client during a very difficult time, and so it's homecoming in so many ways for me, so thank you. What I want to talk about is a little bit stark. So we're at a moment when public health, like so many other things, is in crisis. And that is a story that has a lot of roots, and there is a lot you can say about it. It's a story in part about political polarization and opportunism, taking advantage of the polarization, with public health as, a bit of an innocent bystander being injured. It's a story, honestly, about missteps made by public health officials at various points in history, both recently and distant, some of which are deeply understandable because there are people responding in real time to very complex situations, some of which reflect insularity and paternalism, and often an interaction between understandable reaction to problems in real time and insularity and paternalism and being the subject of opportunistic polarizing attacks. So there's a lot that is at the root of the story of the crisis that public health is in right now. But it's also, very crucially, a story about law. And so what do I mean to say that it's a story about law? Well, over a series of decades, we in the United States built a set of public health institutions and public health practices that were the envy of the world, that had dramatically positive effects on human health. That's true in the United States and around the world. And notwithstanding any limitations we had, these were among the greatest of the achievements of our human race and of human society. The institutions that we built up were marked by support for knowledge generation through supporting research, through supporting surveillance and investigation, support for knowledge dissemination so that when there were fast-moving crises, we had an opportunity to inform people so that they could take action to respond appropriately. These institutions were also marked by an increasing recognition through the years that health problems, particularly but not exclusively infectious diseases, do not respect borders. They don't respect state borders, they don't respect international borders. So a steady recognition that what we need to be doing is moving our resources and our efforts to a federal and indeed international level, breaking down the barriers that our traditionally state-based understanding of the police power in public health had created. Still, substantial resource limitations existed in our public health system. Substantial infrastructural limitations existed in our public health system, and cultural limitations existed in our public health system. But over time, we got better and better and better. We learned from what had happened in the past to significantly improve public health. And these institutions were based on an understanding that in order to achieve the democratically agreed on goal that we want to improve health. This is a goal that was not imposed by elites. This was a goal that people voting in elections, people supporting folks for Congress and for the presidency supported, that what we needed to do was to empower bodies that would be independent, that would call it like they saw it, based on professional understandings, professional ethics, professional norms. Obviously subject to oversight democratically, but as a democratic polity, we recognize that we need to improve the public health, and the way to do that is to provide a significant, strong, independent public health infrastructure. The key elements of this system were embodied in law. They were embodied in statutes that were democratically enacted by Congress over time and amended over time. The Public Health Service Act and the many amendments to it, and many, many others. These statutes created the National Institutes of Health. They created grant programs with particular requirements and particular goals and targets, some of which involve things like health equity, some of which involve things like investigating vaccines, some of which involved infectious diseases, sexually transmitted diseases, and other kinds. There were specific requirements for professionalization of the process for determining what kinds of projects would be funded, including peer review and otherwise. There were statutes that created the CDC and that gave it significant powers for surveillance, for investigation, and for taking action in response to pandemics. There were statutes governing and requiring scientific integrity, including, a whole bunch of statutes I had never heard of before I got to OMB and HHS. And there were statutes that created independent bodies, like the Advisory Committee on Immunization Practices, and empowered them to make decisions according to evidence and professional norms. All of this was subject to political control, executive branch oversight, congressional oversight, but there was a recognition in the law that the independent process of scientific, medical, public health decision-making was essential to ensuring that we were doing what was necessary, often in very complex, often in very fast-moving situations, and often in situations where it was difficult to analyze all of the information. It was essential to have these independent decision makers making decisions according to professional norms. And we had the courts, which stood as a backstop when we had executive branch oversight that crossed the line from engaging in the normal political oversight of the exercise of statutory authorities to particularistic or whimsical or impetuous or impulsive or idiosyncratic or crassly political decision-making. So if we think about a case like the Plan B decisions made by both George W. Bush and Barack Obama, which were nakedly political, and a district court called out the naked politics of those decisions and said, we understand that FDA, which made these decisions or nominally made these decisions, sits on the org chart of the executive branch under the Secretary of HHS and under the President, but we also recognize that FDA had certain statutory requirements that it had to follow, and the Administrative Procedure Act requires it to engage in reasoned decision-making, and naked crass politics is not reasoned decision-making. We are sending it back. So through the years, we built this edifice of independent, professional public health, subject to democratic control, but also with a very substantial degree of insulation from day-to-day crass politics. Now that edifice is crashing down all around us. So the incumbent executive branch administration has throttled knowledge generation in this country and knowledge generation institutions in this country. It has, on a massive basis, stopped grants that had been appropriated by Congress, authorized by Congress, and issued by public health agencies, but also other scientific agencies throughout the years. It has, in significant instances, including right here at Harvard, I'm not always proud of the Harvard University, but I'm very proud of Harvard University and the faculty of Harvard University for standing up against this. But this administration has gone after particular knowledge-generating institutions that are perceived to be enemies, like Harvard, like Columbia, like Brown University, like Northwestern, UCLA, and many others. It has unilaterally determined that it is not going to fund projects that serve policy goals that this administration does not agree with, even when those policy goals are reflected in specific statutes like the Public Health Service Act or in specific appropriations laws. It has overridden the professional peer review process, often set forth specifically in statute. It has taken down the sources of information on which the public relies, so it has throttled not just knowledge generation, but also knowledge dissemination. It has displaced the science-based process that has been set forth in statute and in pre-existing administrative procedures and replaced it instead with a process based on the very particular, very idiosyncratic views of the particular Secretary of Health and Human Services. This includes the purge of the Advisory Committee on Immunization Practices, the move to anti-vaccine approaches across HHS, both in ACIP and in NIH and in the procurement parts of HHS, the skewed presentation of evidence to ACIP and other bodies that are professional bodies, and much else. Massive layoffs and refusals to spend money that have been appropriated by Congress have compounded the problem and threaten not just public health at the federal level, but public health all across the country. State and local public health agencies are strapped in the best of times, and now they're having to cover not being able to expect the funds that had already been appropriated and already budgeted. Okay, so you didn't come here to hear me just talk about how terrible the current administration is, although, trust me, I could do that for a while. This is about law. This is about law because it was legal choices that have enabled this process of the not just deconstruction, but destruction of the public health state. It was legal choices to ensure, as the Supreme Court is well on its way to doing, that there's no effective remedy for the refusal to spend appropriated funds, for mass layoffs that are not justified by any legal justification, for freezes of grants. The Supreme Court, through a series of unexplained shadow docket decisions, is increasingly not explaining, but certainly sending a very clear message that the federal courts, and particularly the federal district courts, will not sit to provide, or should not sit to provide, immediate injunctive relief against unjustified impoundments of funds, or freezes of grants, or massive layoffs. Instead, those kinds of determinations need to be shunted off to other bodies. Court of Federal Claims for impoundments or grant terminations, which maybe after a number of years might provide damages well after the damage is done, well after research projects are unable to continue anymore and have gone away. In the case of RIFs, have to be shunted to the Merit Systems Protection Board, which, by the way, has been deprived of a quorum because the president fired the person necessary to give it a quorum. So those cases might not be heard at all anytime soon. Those are legal choices. Those were disputed legal choices. And yet those have significantly enabled the destruction of the public health state. But there's also another significant legal choice. So the case that the Supreme Court decided not a shadow docket decision last year, this year, last term, that I think is maybe well known to folks in the health law area, not so well known by folks outside of health law, but I think one of the most significant decisions for what's going on, which is the Braidwood decision. Many people sort of saw the Braidwood decision as the bottom line holding is it upholds the constitutionality of the Affordable Care Act's preventive service mandates against an appointments clause challenge. Right, so in that case, the court addressed the U.S. Preventive Services Task Force and the question whether the U.S. Preventive Services Task Force, which is a set of supposedly independent people who are appointed by a person who is appointed by the Secretary of HHS, whether those folks who aren't necessarily officers of the United States under Article 2 of the Constitution can make decisions that have the effect of binding insurers to provide preventive services. The court said, yeah, that's constitutional. And a lot of people read that headline and moved on. But the reasoning that the court gave there was that that's constitutional because the Secretary of HHS, we are going to read as having complete power to fire members of the U.S. Preventive Services Task Force until he gets the answer he wants. He has sufficient supervisory authority over the U.S. Preventive Services Task Force because he gets to fire folks and then ask them to try again once he reconstitutes the task force. And if they continue to defy him, fire them again, and on and on and on, and eventually they will bend to his will. And, at some level that makes some sense until you remember that the statute setting up the U.S. Preventive Services Task Force said that the individuals on the task force are to be independent. And it's especially important, so the court is, as a constitutional matter, reading that independence requirement essentially out of the statute. What the court said, what Justice Kavanaugh, who wrote the court's opinion, said was, well, we read that independence requirement as independent of their outside employers. Like if they work for Harvard University full-time and then part-time are on the Preventive Services Task Force, they're independent of Harvard's interests, but they're not independent of what the secretary tells them, which is a bonkers reading of the statute, use a technical term, if you're actually trying to understand the statute in context and what it says and what is clearly trying to do and what Congress was trying to do. But it makes sense if you have an overriding constitutional principle that everyone who works within the executive branch has to answer to the whims of the people in charge. And the court drops a footnote saying, by the way, ACIP is not at issue in this case, although there's also a preventive service mandate for that, but the same analysis would apply there. So everything that the current Secretary of Health and Human Services is doing with regard to ACIP is significantly empowered by the Supreme Court's decision this year. So that is a decision based on this unitary executive theory, this idea that the president is the only nationwide elected official. Everybody within the executive branch has to be accountable to the president such that the president can direct them what to do. And we're going to clear away guarantees of independent judgment. It's worth noting in my last minute and a half that there is another way of understanding administrative democracy. Right? The unitary executive theory is presented as the only way to understand constitutional democracy. The president is elected by the people, so of course he gets his way over independent folks. But of course, voting for the president is not the only way in our constitutional democracy people exercise a voice. They also vote for Congress. And voting one time is not the only time they exercise their voice. They vote over and over and over again. And when people vote for the president, they're not necessarily endorsing everything the president or someone he appoints to be Secretary of Health and Human Services might do. Instead, we have a democratic process in this country where, over time, Congress, which is democratically responsive, often much easier for people to have access to. I can talk to my congresswoman every week at the farmer's market, and I do run into her there. Congress, over time, adopts rules in this case, adopted rules to create independent agencies and independence within executive branch agencies, and is responsive to the people in making changes. And the very particular view of unitary executive democracy, I think we're seeing the harms of in this current crisis of public health, and I think we need to think about a different way of doing things. So, thank you very much.
We're going to do questions. So we've got 5 minutes of questions, or 5 or 6 minutes. Again, you need to string your mic, or you can do it from the mic as you prefer. Does anybody have a question they want to ask Mr. Bagenstos? Quiet group.
I think they're afraid I'll yell at them now.
Oh, they're right. That's the question.
That was one of my, yeah.
Anybody want to ask a question? Opportunity? Yeah.
I'm going to do a second for it. Sally Jesse Raphael glasses. Go ahead.
Thank you for those remarks, really meeting the moment. Earlier today, I was talking with some patient advocacy groups about the situation with ACIP, with vaccine guidelines, and trying to figure out, okay, where might this go? Are we going to see this with USPSTF, especially after Braidwood? What's going to happen with the HIV treatment guidelines? And I was wondering if you could trend forecast in health law. That is not asking you what color we might all be wearing, but where do you see the response? Is it the interstate coordination, like in New England and the Western states? Is it private actors, like medical societies?
Well, I think, as a practical matter, it's all of those things, and I think it's deeply unfortunate. So we're already seeing states getting together in default of the federal government acting. As I said at the beginning of this talk, there's a reason why we do things at the federal level. I mean, in our system, I know people have arguments various ways about this. I think as a practical matter, it's just true that the federal government can command more resources than all of the states can, because the states are in competition with each other, on taxes. And so as a practical matter, if we don't have the federal government coming together and providing leadership, it's going to be much less efficient. It's going to be much less effective. And again, disease knows no borders. So, but yes, we are seeing states doing this already. I mean, what we're seeing with COVID vaccination after the sort of very confusing decisions about limiting the COVID authorization, we're seeing some states stepping in, like in Massachusetts, and state health commissioners issuing standing orders. One of the things that I've talked to some folks about is maybe states should buy up vaccine and provide it to people, kind of like we did, early in COVID. But that was the federal government doing it. But perhaps states should do it because people are going to have difficulty accessing their insurance in some states, depending on the kinds of questions that get asked by pharmacies and providers. So I think that's definitely part of it. States are coming together on information sharing and on information dissemination. There are also private entities stepping in on this. And I think all of this is super important. I guess what I'd say is it's all dramatically of a smaller scope than what the federal government could do if it were doing its job. Even when the federal government had all sorts of problems, and I don't think that what we did in the Biden administration during the COVID pandemic was perfect. And I don't think we had all the resources we needed, and I don't think states had all the resources they needed. Still, much, much, much better than what can happen if states and willing private parties are going it alone. But yes, I think that's what's going to happen.
One more question to ask. Go ahead.
Sure, maybe this is a tough one, but is there anything giving you hope right now in this realm? Like either state, local, international? You're like, oh, this is at least giving me some hope.
Well, I guess what I go back and forth. I mean, yes, I came across as like angry Sam just now, and kind of ticked off about what's going on in the world. But actually, I will say, I think people. I mean, the Democratic point I made is one I really believe. I don't think people voted for this. Okay, I think people voted for a big change. I think people voted, maybe people voted to knock people like me and like Rochelle down a peg. Okay, I totally get that. People didn't vote for the destruction of cancer research in America. People didn't vote, for measles being everywhere, for not having vaccines be available when you want them. And notice, we hear the talking point still, anybody who wants a COVID vaccine can get it. As a formal legal matter, that's true because, this is, the COVID vaccine's been authorized for some people, for some indications, so it can be prescribed off-label for anyone. But as a practical matter, there are lots of people who can't get it. But the fact that they feel the need to say anyone who wants it can get it, I think shows that people don't want a situation where, we can prevent serious illness and we're not letting people have access to the way to prevent it. And so I think now that people are seeing that, I think, people are responding. I think we need to make, I could have gone on for an hour. I actually have a long paper I'm writing about where to go in the future on this. And I think there are substantial changes we need to make to our public health system. Maybe we'll get closer to that now, but I really am deeply in despair about what we have to go through to get there.
Big round of applause for Professor Bagenstos.
And I'm sorry I have to catch the plane. I'm not leaving because